Hey, good morning, everybody. As Richard just said, I'm Trina Anglin, and I'm representing the Health Resources and Services Administration's Maternal, Child, and Health Bureau. And I've been asked today to provide a perspective on why it is that the Maternal and Child Health Bureau was interested in working with the IOM and the National Research Council on this very topic of young adult health, safety, and well-being. Okay, I wanted to tell you that yesterday, while I was attending the annual meeting of the Pediatric Academic Societies, I had the opportunity to attend a remarkable symposium. It was called Rare Diseases Growing Up, a Life Course Perspective. And the idea was for eminent researchers who actually represented very, very discrete disciplines within pediatrics and actually internal medicine to talk about the ramifications of children who either had been born with or had acquired rare congenital diseases and what happened to them as they were growing up. So that they discussed congenital heart disease, they discussed chronic renal disease, especially those in renal failure. They talked about young people who had developed diabetes mellitus type 1 as they were young children. And that finally, there was a really nice discussion on bone health. Like what are we doing with all of the toxic medications that young people receive and recognizing that bone mass is so important, especially to women, to prevent osteoporosis as they become older. And I breathed to myself, what a remarkable symposium. And afterwards, when I was thinking about what I was going to say today, I was querying myself, why did I use that term remarkable? I mean, the content, the medical content was absolutely outstanding. And it occurred to me that the audience, which was composed of people who actually were subspecialists, most of them researchers themselves in these disciplines, but there were also some general pediatricians in the office. And that the range of questions in the discussion afterwards, of course, talked about the technical aspects, but really interestingly, talked about the transition of adolescence to young adulthood, what training issues really needed to be taken into consideration. And that was really the heart of the discussion. And I thought, this is really neat. I don't always get to go to that meeting, but in a book that was close to 400 pages long, I tried to count the number of submissions and abstracts that were relevant to young adults. And I stopped at about page 150, but I only came up with a handful. That was really the only real symposium on this topic. But it is a real beginning for pediatrics and then for internal medicine. So I thought, what a great way, like one day ahead, to start our own workshop. So why is it that the Maternal and Child Health Bureau is so interested in the health, safety, and well-being of young adults? We've known for a really long time. I've known personally since at least 30 years that young adults actually have a worse set of health outcomes than do adolescents. And if one thinks carefully, is that the older an adolescent becomes, the higher the morbidities and mortalities happen to be. So overall, for example, when we're thinking about the public health profile of young adults, is that we know that the rates of death from motor vehicle crashes, from homicide, from suicide, are significantly higher than those of adolescents, that they are more likely to use tobacco, and by that time that they probably have made kind of a behavioral commitment to that they are more likely to be engaged in the illicit use of drugs and more apt to binge drink, and that, of course, they are at higher risk for acquiring HIV. And those are just examples. Okay, secondly, social issues of special importance to young adults really have a bidirectional relationship with health. So again, some key examples are, we know that young adults, especially young adult males, are at the highest risk of any group in our society, and especially those who come from minority backgrounds, to be arrested, especially for serious crimes. And so young people who are engaging in that type of behaviors frequently do have some health issues, including mental health issues. But think about what happens to them when they become incarcerated. I mean, you can see that the bidirectional relationship just intuitively. Okay, think about homelessness. We know that young adults, especially single young adults, are at very, very high risk for homelessness compared to other populations. And that when we think about families who are at risk for homelessness, those who are headed by a single young adult female again are at highest risk. And we know that families who are homeless have a multitude of health issues. There low employment. I mean, this is the age group that's least likely to be employed, especially young people who have not graduated from high school. Think about low literacy rates among young adults, and we know that people who have not done well in school, who have low literacy, actually are at risk for many more and more significant health issues as they become full-fledged adults. And finally, think about our young immigrants, especially those who are undocumented and quite frankly have very, very little opportunity to seek health care in this country. Okay, we know that, speaking of that access to and use of health care is the lowest amongst this population group. Now, it's nominally considered to be very healthy, but they actually underutilize health resources. The Affordable Care Act seems to be offering some hope. Since 2010, one of the very first provisions that was enacted mandated that parents with commercial health insurance plans could then include their young adult children up to the age of 26 on those plans. And following that there was a real significant increase in the number and the percentage of young adults who were insured, especially young adult males. And that's the population group which is least likely to be insured. Okay, think about young adults who actually do have those chronic diseases that I had mentioned earlier, who have disabilities. Think of all of those with mental disorders in particular. Okay, is that what about, like during young adulthood, it's very likely that they will no longer be under the care of their parents, and so living in the community or living in some other type of setting has profound implications both for them as well as for society. And in addition, as I had mentioned previously, is that their transition to the adult health care system, and I know we're going to be hearing about this during the workshop, is a huge change for them, and that the pediatric health care system is not quite ready to give them up, and the adult health care system, quite frankly, is not quite ready to accept many of them, especially those who have very, very complex issues. We'll be hearing later during the workshop about military service. And that actually, in some ways, is an iconic example, is that we know that, especially for young adults who themselves come from impoverished backgrounds, this actually represents a pathway of opportunity, but that a large proportion of them no longer qualify for military service. And that might be because of health reasons, because they're overweight or can't meet physical activity standards, or because of their own backgrounds, because they've not graduated from high school, cannot pass the examinations that need to be passed, or actually have some type of a criminal record. And really importantly, and this is so important to HRSA, is that compared to adolescents, who remember are minors, is that young adults have no special safety nets. They really are considered adults, even though their brains might not be acting as those of a full-fledged adult. Remember that adolescents, and no matter how much we complain about the sort of the paucity and the nurturance of healthcare services for adolescents, they're far better, they're in a far better position than young adults are. So think about the young adults that actually need to fall under the adult healthcare system as soon as they reach the age of majority. So think about two high school seniors. One is 18 and one is 17, and that they both commit a similar crime. By law, nationally, it's that the 18-year-old would automatically become a part of the adult justice system, and that in many states, thankfully, that the 17-year-old would still remain under the juvenile justice system. Those systems are so different and have profound implications, basically for the trajectory of the rest of their lives. Okay, yeah, no known federal or state entity has developed any type of a structure or a set of systems that can address the really complex needs of young adults. and that, that we're just starting, I think, and we're hoping that this workshop and that our entire contract with the IOM is going to serve as a stimulus, to encourage other agencies within the federal government and agencies within the federal government to work together, agencies at the state level, and all of these key stakeholders within the private sector to start setting their sights in a really constructive way on this population group. You saw that the title of this workshop, said a forgotten population. And it's because we really overlook them other than in a punitive sense. And so that our aspiration is that we can turn that tide and for people to start thinking about the needs of young adults, but to be doing it in a very proactive and a very constructive and supportive way. Okay, I'd like to talk a little bit, and Richard had mentioned this, now kind of the roles of the members of you and of me, is that we need you to serve as synthesizers. This is a very, very crowded agenda, and so there's probably not going to be quite as much time for open discussion as we would like. And you're going to be learning about a variety of complex issues from experts who are representing a variety of different disciplines. And so that as you're listening to the various presentations, that we'd like you to step back and in your own mind to appreciate the larger contexts. So to be able to apply the actual information that you'll be absorbing from each presentation to all of the other domains that are important to the study of young adulthood. And so, for example, I want you to think about how the various findings fit together as a really fluid picture of young adults. What areas appear to be aligned, and what pieces do not appear to fit? Like what's kind of is jarring to you? What's surprising? And we'd like you to join with our young adult discussants, and we're so appreciative of being able to have young adults to be an active part of our workshop, to identify gaps, and to really to think like what is missing, because this is just the first workshop that we're going to be sponsoring, and so that if there are areas that you think are really vital, I suspect that our staff, I know Kimberly Bogard and Claire Stroud will be able to incorporate those areas into our future planning. So thank you very much for being here.